So the next section, we're going to talk about the qualities of an adaptive organization. We've talked about the nature of adaptive leaders and adaptive problems. So what are the qualities of adaptive leadership? And here, there are 5 of them here, and I'm going to describe them individually. And then we're going to ask you to think about your own organizations in terms of these different characteristics. So the 5 of them are, first of all, that the elephants in the room are named. Secondly, that the responsibility for the organization's future or the collaborative's future is shared. Thirdly, that independent judgment is valued and respected. Fourth, that leadership capacity is developed. And fifth, reflection and continuous learning are institutionalized. They all sound like good things, but they're all quite challenging. So the first of these is naming the elephants in the room. And on the slide, you see the aspects of all meetings moving forward. And as you read that, I want you to think about your own experience in leadership councils or meetings with staff, the extent to which these are present or not present. The public explicit conversation on the ostensible agenda is, I think, is there in almost all meetings. But the informed chat and hallway meetings prior to the meetings, not always so visible, nor are the internal conversations that unfold in participants' heads and the sideways glance that where people look at each other when they hear something that they like or they don't like. And then the meetings after the meetings where people discuss whether or not they've achieved what they really want to happen or what did happen in the meeting. So all those things could be present in meetings. The question is, whose responsibility is it to name the elephant in the room? And Heifetz would say it's the responsibility of adaptive leaders to be very transparent about this, to be very clear. We do come in with competing commitments. We come in with different histories. We come in with different experiences, and we come in with different views of what the future could look like. We need to make those a little less hidden and a little more obvious. It's very hard for people to do this, but if we're going to make decisions that are in the interest of the collective, we have to stop playing games in meetings and start being open about what the opportunities are and what the challenges are moving forward. And in doing that, we start to create the shared responsibility for the organization's future. So in highly adaptive organizations, people share that responsibility. It's not any one person's responsibility, it's a collective responsibility, and we have to start to address the complex issues and future plans jointly and not allow some people to get off from this responsibility. And some time ago, about 15 years ago, as we were doing research on high-performing healthcare systems in several different environments, one of the case studies we wrote was the case study about Jönköping Health Authority, which is in southwestern Sweden. And Sven-Olof Carlsson, who was the CEO at the time of Jönköping, which was an organization responsible for care for about 300,000 people in Sweden, and a complex, challenging role with many different parts and many different things happening. But Sven-Olof Carlsson started all his meetings with no agenda and asked the leaders around the table what they saw as the most important issues, instead of just going immediately to reports from people with different roles in the organization. And he saw this as a way to really do 2 things. First of all, is to surface the challenges and issues that leaders saw across the organization. And secondly, to build a sense of common commitment to work on those issues together as a leadership team. So this idea about creating shared responsibility, and there's other ways to do it as well, I think is an interesting and a way to move forward to create something that has a bigger opportunity and a bigger investment. So related to that is this idea about independent judgment, valued and respected. And many of us have been in meetings where we saw people who spoke up and said some of the unsaid comments, the issues that others weren't talking about. We need to value those opportunities to be part of the conversation, to be a little disruptive, a bit of a renegade, to unpack the rationale, to explain to people what they saw as going on here. Leaders need to value, leaders need to encourage people who do this. because it helps to create a broader conversation. And one of the ways to do this is to add patients and family members who are well informed and who can come in and represent views that are not already the views of people at the table, to broaden perspectives and to strengthen outcomes. So this idea that patients and family members slow down meetings has some truth to it, but in slowing down the meetings, they can sometimes surface views and ideas that otherwise wouldn't be present. And building leadership capacity, this is true of this as well. As we move forward in the work of integrated care, we need to have new people step forward whose leadership is based on experience, knowledge, and understanding that isn't already present among leaders already at the table. So we need to increase our investment in leadership, not only among those who are already seen as leaders, but those of us who are emerging as leaders, and give them the opportunities and mentorship necessary to move that forward. And lastly, we need to think about institutionalizing reflection and continuous learning in our work with our staff and in our work in leadership councils. And I think there's some really good practices around this, about debriefing at the end of every meeting. How did we do today? What issues were well addressed? What issues weren't well addressed? What do we need to do next time to make this a more productive meeting? So adaptive leadership requires this ongoing learning to understand what current performance is like and where we need to move to be more effective as a leadership team or as a staff group moving forward. And to be very open about this moving forward. What went well, even better if we did something different. So I've added this as well to the ones that Heifetz identifies, this idea about shared decision making, because all those previous components are really part of this capability to bring partners together and to act, with a common interest towards a common good, to really make a difference for the group as a whole. This requires a high degree of trust. It requires some learning, and it requires some patience, as we sometimes spend time on issues that others don't think are really important, in order to build an understanding about who's represented at the table and what we need to do moving forward.